If you want to learn how to implement the ketogenic diet and the Press Pulse protocol into your cancer management, just visit school.com/keto for cancer, the new community by our research analyst Johnny Rockermeyer. Within this new community platform, you can connect with other patients and learn from their experiences. A ketogenic diet as a metabolic vehicle for enhancing the therapeutic efficacy of mebendazole and devimestat in preclinical pediatric glioma. Abstract. Invasion of high-grade glioma, HGG, cells through the brain and spinal cord is a leading cause of cancer death in children. Despite advances in treatment, survivors often suffer from lifelong adverse effects of the toxic therapies. This study investigated the influence of nutritional ketosis on the therapeutic action of mebendazole, MBZ, and devimestat, CPI 613, against the highly invasive VMM3 glioblastoma cells in mice. Introduction. The alarming rise in incidence of glioblastoma, GBM, across all age groups over the last 21 years requires immediate action for management and prevention. Diffusely infiltrating pediatric high-grade gliomas, HGGs, are the leading cause of cancer death in children in the U.S., with no improvement in management in over 10 years. Most survivors experience multiple adverse effects that significantly reduce quality of life. The response to chemotherapy is poor in most pediatric brain cancer patients, with survivors experiencing unacceptable toxicity and reduced quality of life. Temozolomide chemotherapy, which has only modest therapeutic benefit in adult glioma patients, is overly toxic and without therapeutic benefit for pediatric brain cancer patients. This failure is likely due to the metabolic properties of the neoplastic tumor cells. In contrast to the complex genetic heterogeneity seen in gliomas, aerobic glucose fermentation, Warburg effect, is the common metabolic phenotype seen in most high-grade pediatric and adult gliomas. In addition to aerobic carbohydrate fermentation, brain tumor cells are also dependent on glutamine fermentation for growth and survival. We recently showed how the glutamine antagonist, 6-diazo-5-oxo-L-norleucine, DON, administered together with a calorically restricted ketogenic diet, KDR, managed late-stage orthotopic growth in 2 syngeneic mouse models of GBM. DON targets glutaminolysis, while the restricted ketogenic diet reduces glucose and simultaneously elevates ketone bodies that are neuroprotective and non-fermentable. The diet-drug therapeutic strategy killed tumor cells while reversing disease symptoms and improving overall survival. The antiparasitic drug mebendazole, MBZ, showed preclinical efficacy in models of glioblastoma and medulloblastoma. The mechanism by which mebendazole inhibits tumor growth is due in part to the inhibition of glucose uptake in glycolytic enzymes. Mebendazole has relatively low toxicity in both adults and in children. As systemic bioavailability is best when mebendazole is administered orally with fatty foods, we administered mebendazole with a ketogenic diet to young mice with invasive VMM3 glioma in this study. VMM3 glioblastoma cells invade the spinal cord from the brain implantation site in young mice. VMM3 tumor cells were implanted into the brains of young mice of the syngeneic VMDK inbred strain. The mice were imaged for bioluminescence on day 6 after tumor implantation to ensure tumor uptake. The ketogenic diet enhances the therapeutic effects of mebendazole and DON against VMM3 glioblastoma cell growth in brain and spread to spinal cord in young mice. After bioluminescence imaging, the mice were divided into diet-drug groups. Mebendazole, 100 mg per kilogram body weight, was administered to the mice in the ketogenic diet group for 3 consecutive days per week. The ketogenic diet, without mebendazole, was administered alone on the off days. DON, 1.0 mg per kilogram body weight, was injected once or twice per week. All in all, there were 4 experiments conducted in this study, all studying different cohorts, but with the same results. Experiment 1. The imaging data in Figure 1D through G show that brain bioluminescence, indicated as number of photons times 10x, was significantly lower, both in vivo and ex vivo, in the mice treated with ketogenic diet plus mebendazole or with ketogenic diet plus DON, than in either mouse group receiving the ketogenic diet alone, or in the 2 mice that received the chow diet alone. Chow meaning a standard diet high in carbs. We will show you the figures of this study in the second part of this video. The photon measurement is indicative of tumor ATP synthesis and viability. The greater the bioluminescence, photon counts, the faster the tumor growth, while the lower the bioluminescence, the slower the tumor growth. Experiment 2. The greatest reductions in brain bioluminescence were seen in the ketogenic diet plus mebendazole and ketogenic diet plus DON groups, indicating a significant diet-drug therapeutic synergy. Experiment 3 involved a further evaluation of the ketogenic diet plus mebendazole compared to the chow control group. Ex vivo bioluminescent photon values were compared for individual mice that were either untreated, chow control, or treated with ketogenic diet plus mebendazole, 100 mg per kilogram body weight. Brain photons were counted 12 days after brain implantation of VMM3 tumor cells. It is clear that the tumor cell bioluminescence was significantly lower in the mice receiving ketogenic diet plus mebendazole than in the mice receiving the control chow diet. The data from experiment 4 showed that overall survival was longer in the ketogenic diet-fed mice than in the chow-fed control mice. But the overall survival was significantly longer in mice receiving the ketogenic diet additionally containing either mebendazole or DON, than in mice receiving the ketogenic diet alone. The mice on diet, drug therapy were ambulatory and appeared healthy in contrast to the control chow-fed mice that were sedentary and appeared moribund. Histopathological analysis revealed massive tumor cell death without obvious invasion in the brains of mice fed the ketogenic diet plus mebendazole. Mebendazole targets both the glutaminolysis and the glycolysis pathways in cultured VMM3 cells. Mebendazole treatment reduced the bioluminescence in the VMM3 cells in a dose-dependent manner. Bright field images showed that mebendazole killed the tumor cells at the highest dose, in contrast to mebendazole, which showed a dosage effect for viability. No dosage effect for proliferation was seen for DON. About 50% of the tumor cells were killed after 24 hours of the treatment. Figure 2G shows that both glutamine and glucose are required for VMM3 tumor proliferation. MBZ treatment significantly reduced the proliferation as we noticed in Figure 2C. Mebendazole apparently caused a reduction in glutaminolysis metabolites. This reduction could reduce ATP synthesis through mitochondrial substrate level phosphorylation at the succinyl-CoA ligase step in the TCA cycle. This reduction could then reduce metabolite levels in the glycolytic pathway, as reflected at 6 hours. These results suggest that mebendazole targets both the glutaminolysis and the glycolysis pathways in the VMM3 tumor cells. The maximum therapeutic benefit of mebendazole on tumor invasion and mouse survival occurred only when the drugs were administered together with a ketogenic diet, KD. Mebendazole reduced tumor cell growth and invasion when evaluated under in vitro and in vivo conditions, through inhibition of both the glutaminolysis and the glycolysis pathways. This preclinical study in juvenile mice highlights the potential importance of a diet-drug therapeutic strategy for managing childhood brain cancer. Here we show for the first time that devamistat and mebendazole are therapeutically synergistic when administered together with a ketogenic diet in juvenile mice with invasive VMM3 brain tumor. Moreover, we report for the first time that mebendazole can target the glutaminolysis pathway of VMM3 cells, both in vitro and in vivo. These findings further support the dependency of the invasive VMM3 glioma cells on glutamine for growth. Both drugs prevented dissemination of the VMM3 tumor cells from the brain to the spinal cord when administered together with the ketogenic diet in young mice. Moreover, minimal drug dosages could achieve remarkable non-toxic improvement in overall survival when administered with the ketogenic diet. This novel diet-drug cocktail therapy will have significant translational impact for children with malignant brain cancers. Results. The aim of this research was to determine if a ketogenic diet could improve the therapeutic action of mebendazole against the progression of the VMM3 preclinical glioblastoma in the juvenile mouse brain. None of the mice received radiation or steroids as a part of the metabolic treatment protocol, in order to avoid the provocative effects of elevated blood glucose and systemic inflammation on tumor growth. Part 2. Visual analysis of the study results. Experiment 1. In Figure 1G, we see the brain bioluminescence of the mice, indicated as number of photons. The photon measurement is indicative of tumor ATP synthesis and viability. The greater the bioluminescence, the faster the tumor growth, while the lower the bioluminescence, the slower the tumor growth. While the two control groups with the normal high-carb chow are on the left-hand side, the ketogenic diet in the middle did already lower the photon count considerably. But the mice treated with a ketogenic diet plus mebendazole or plus DON had even lower photon counts than the ketogenic diet alone, meaning that the tumor growth rate in these groups was by far the lowest. The difference is quite impressive, especially compared to the control groups. In Figure 1H, we see the results of Experiment 2. Like in the first one, the ketogenic diet is already helping with keeping tumor growth in check. But the greatest reductions in brain bioluminescence were seen in the ketogenic diet groups plus mebendazole or plus DON. In this case, the mebendazole was even a bit more powerful than the DON. This is our last graph from Experiment 3, Figure 1I. It shows a further evaluation of a ketogenic diet plus mebendazole, in this case compared to a chow control group, and in individual mice. Brain photons were counted 12 days after brain implantation of VMM3 tumor cells. It is clear that the tumor cell bioluminescence was significantly lower in the mice receiving KD plus mebendazole than in the mice receiving the control chow diet. The values as a whole dropped impressively. What's more impressive is that in 2 mice the tumor activity almost showed no photon signals at all, meaning that tumor growth had almost completely halted. If you want to learn how to implement the ketogenic diet and the Press Pulse protocol into your cancer management, just visit school.com/keto for cancer, the new community by our research analyst Johnny Rockermeyer. Within this new community platform, you can connect with other patients and learn from their experiences. You can also just search through the posts other members have already made. You will have access to our classroom section as well, which provides practical advice and tools for the best results. These sections cover all parts of the Press Pulse protocol that you should implement. Starting with the general scientific concepts by Dr. Thomas Seyfried, we will show you how to start the ketogenic diet, including which foods to choose and which to avoid. Additionally, we prepared a list of doctors specialized in metabolic therapy, as well as details about glutamine inhibition and hyperbaric oxygen protocols. So, take a look around at school.com/keto for cancer. The ketogenic diet and hyperbaric oxygen therapy prolong survival in mice with systemic metastatic cancer. Abstract. Introduction. Abnormal cancer metabolism creates a glycolytic dependency which can be exploited by lowering glucose availability to the tumor. The ketogenic diet, KD, is a low-carbohydrate, high-fat diet which decreases blood glucose and elevates blood ketones, and has been shown to slow cancer progression in animals and humans. Abnormal tumor vasculature creates hypoxic pockets which promote cancer progression and further increase the glycolytic dependency of cancers. Hyperbaric oxygen therapy, HBOT, saturates tumors with oxygen, reversing the cancer-promoting effects of tumor hypoxia. Since these non-toxic therapies exploit overlapping metabolic deficiencies of cancer, we tested their combined effects on cancer progression in a natural model of metastatic disease. Methods. We used the Firefly luciferase-tagged VMM3 mouse model of metastatic cancer to compare tumor progression and survival in mice fed standard or ketogenic diet ad libitum, with or without HBOT, 2.5 ATM absolute, 90-minute sessions, 3 times per week. Tumor growth was monitored by in vivo bioluminescent imaging. Results. The ketogenic diet alone significantly decreased blood glucose, slowed tumor growth, and increased mean survival time by 56.7% in mice with systemic metastatic cancer. While HBOT alone did not influence cancer progression, combining the ketogenic diet with HBOT elicited a significant decrease in blood glucose, tumor growth rate, and 77.9% increase in mean survival time compared to controls. Conclusions: the ketogenic diet and hyperbaric oxygen therapy produce significant anti-cancer effects when combined in a natural model of systemic metastatic cancer. Our evidence suggests that these therapies should be further investigated as potential non-toxic treatments or adjuvant therapies to standard care for patients with systemic metastatic disease. Introduction. Metastasis is a complex phenomenon in which cancer cells spread from a primary tumor to establish foci in a distal tissue and is responsible for 90% of cancer-related deaths. While many primary tumors can be controlled with conventional therapies like surgery, chemotherapy, and radiation, these treatments are often ineffective against metastatic disease and in some cases may promote cancer progression and metastasis. There is a substantial need for novel therapies effective against metastatic cancer. The VMM3 model of metastatic cancer is a novel murine model that closely mimics the natural progression of invasion and metastasis. The VMM3 tumor arose spontaneously in the brain of a mouse of the VMDK inbred strain and expresses multiple growth characteristics of human glioblastoma multiforme with macrophage, microglial properties. Systemic metastasis has also been repeatedly documented in human glioblastoma multiforme, GBM, which has been linked to the macrophage, microglial characteristics of the tumor. The VMM3 model of metastatic cancer has a distinct advantage over other metastatic models because it spreads naturally in an immunocompetent host, mimicking the natural cancer microenvironment. For these reasons, the VMM3 model of metastatic cancer was used for this study. Abnormal energy metabolism is a consistent feature of most tumor cells across all tissue types. In the 1930s, Otto Warburg observed that all cancers expressed high rates of fermentation in the presence of oxygen. This feature, known as the Warburg effect, is linked to mitochondrial dysfunction and genetic mutations within the cancer cell. These defects cause cancers to rely heavily on glucose for energy, a quality that underlies the use of fluorodeoxyglucose PET scans as an important diagnostic tool for oncologists. Ketogenic diets are high-fat, low-carbohydrate diets that have been used for decades to treat patients with refractory epilepsy. Dietary energy reduction, DER, lowers blood glucose levels, limiting the energy supply to cancer cells, while elevating circulating blood ketone levels. Ketone bodies can serve as an alternative energy source for those cells with normal mitochondrial function, but not for cancer cells. Dietary energy reduction has been shown to have anti-tumor effects in a variety of cancers, including brain, prostate, mammary, pancreas, lung, gastric, and colon. Dietary energy reduction produces anti-cancer effects through several metabolic pathways, including inhibition of the IGF-1, PI3K, ACT, HIF-1, a pathway which is used by cancer cells to promote proliferation and angiogenesis and inhibit apoptosis. Additionally, dietary energy reduction induces apoptosis in astrocytoma cells, while protecting normal brain cells from death through activation of adenosine monophosphate kinase, AMPK. Tumors possess abnormal vasculature which blocks adequate tissue perfusion, leading to the presence of hypoxic regions that promote chemotherapy and radiation resistance. In fact, hypoxic cancer cells are 3 times more resistant to radiation therapy than are well-oxygenated cells. In addition to decreasing the efficacy of standard care, tumor hypoxia activates a number of oncogene pathways, largely through the HIF-1 transcription factor, which promote tumor growth, metastasis, angiogenesis, and inhibit apoptosis. Hyperbaric oxygen therapy, HBOT, involves administration of 100% oxygen at elevated pressure, greater than sea level, or 1 atm. HBOT increases plasma oxygen saturation, which facilitates oxygen delivery to the tissue independent of hemoglobin oxygen saturation. The potential benefit of using HBOT to combat the cancer-promoting effects of tumor hypoxia is clear. HBOT alone has been shown to inhibit tumor growth, reduce tumor blood vessel density, and induce the preferential expression of anti-cancer genes in rat models of mammary tumors. Additionally, radiation and many chemotherapy drugs work by producing free radicals within the tumors, leading to cell death. HBOT enhances tumor cell production of reactive oxygen species, which contributes to the synergistic effects of HBOT as an adjuvant treatment to standard care. Indeed, HBOT enhances the efficacy of both radiation and chemotherapy in animal models. In normal tissues, decreased oxygen availability inhibits mitochondrial production of ATP, stimulating an upregulation of glycolytic enzymes to meet energy needs by substrate-level phosphorylation production of ATP. Thus, the cellular response to tumor hypoxia is mediated by several of the same pathways that are overly active in cancer cells with mitochondrial damage and high rates of aerobic glycolysis. This suggests that the ketogenic diet and HBOT could target several overlapping pathways and tumorigenic behaviors of cancer cells. We hypothesize that these treatments would work synergistically to inhibit tumor progression. We suggest that the addition of these non-toxic adjuvant therapies to the current standard of care may improve progression-free survival in patients with advanced metastatic disease. Materials and methods. Mice. 3 breeding pairs of the VM-DK strain of mice were used to establish and propagate a VM-DK mouse colony. 40 adult male mice, 10 to 18 weeks of age, were used for this study. Subcutaneous tumor implantation. On day 0, VMM3, flux cells, 1 million cells in 300 milliliters PBS, were implanted into the abdomen of VM-DK mice. Inoculation results in rapid and systemic metastasis to most major organs, namely liver, kidneys, spleen, lungs, and brain. Diet therapy. On the day of tumor inoculation, mice were randomly assigned to one of 4 groups: standard diet, control, standard diet plus HBOT, ketogenic diet, or ketogenic diet plus HBOT. Mice in the standard diet group were fed standard rodent chow ad libitum. Mice in the ketogenic group received KD Solus ketogenic diet ad libitum as well. Hyperbaric oxygen therapy, HBOT. Mice undergoing HBOT received 100% oxygen for 90 minutes at 1.5 atm gauge, 2.5 atm absolute, 3 times per week, Monday, Wednesday, Friday, in a hyperbaric chamber. Bioluminescent imaging and tumor growth analysis. Tumor growth was monitored as a measure of bioluminescent signaling. Approximately 15 minutes prior to in vivo imaging, the mice received an injection of D-luciferin. As only the cancer cells contain the luciferase gene, bioluminescent signal, photons per second, of the whole animal was measured and tracked over time as an indicator of metastatic tumor size and spread. Statistics. Correlation between blood glucose, body weight change, and survival times were analyzed by linear regression analysis. Results were considered significant when p was greater than 0.05. Results. Combining the ketogenic diet with HBOT prolonged survival in mice with metastatic cancer. Ketogenic diet and ketogenic diet plus HBOT treated mice demonstrated a statistically different survival curve by log-rank test with an increase in survival time compared to control animals. Ketogenic diet fed and ketogenic diet plus HBOT animals also showed a significant increase in mean survival time compared to control animals. Although previous studies have reported that HBOT alone can increase survival time in animals with various cancers, we did not see an effect on survival in mice receiving standard diet plus HBOT. The ketogenic diet alone increased mean survival time by approximately 17 days, 56.7%, and when combined with HBOT, mice exhibited an increase in mean survival time of approximately 24 days, 77.9%. Figure 1b. This finding strongly supports the efficacy of the ketogenic diet and HBOT as therapies to inhibit tumor progression and prolong survival in animals with metastatic cancer. Figure 1. The ketogenic diet and hyperbaric oxygen therapy increases survival time in mice with systemic metastatic cancer. Figure 1b. Treatment group cohort size and mean survival times. Ketogenic diet mice exhibited a 56.7% increase in mean survival time compared to controls. and ketogenic diet plus HBOT mice exhibited a 77.9% increase in mean survival time compared to controls. The ketogenic diet and HBOT decreased tumor bioluminescence. Bioluminescence signal was tracked as a measure of tumor size throughout the study. Animals receiving the ketogenic diet alone or in combination with HBOT demonstrated a notable trend of slower tumor growth over time. This trend was more pronounced in ketogenic diet plus HBOT mice and reflected the increase in survival time seen in these animals. See Figures 1 and 2. Have been previously. Figure 2. Tumor bioluminescence in mice. Treatment. Tumor growth was slower in mice fed the ketogenic diet than in mice fed the standard diet. Figure 2a. Representative animals from each treatment group demonstrating tumor bioluminescence at day 21 after tumor cell inoculation. Treated animals showed less bioluminescence than controls with ketogenic diet plus HBOT mice exhibiting a profound decrease in tumor bioluminescence compared to all groups. Ad libitum. Figure 2b. Total body bioluminescence was measured weekly as a measure of tumor size. Ketogenic diet plus HBOT mice exhibited significantly less tumor bioluminescence than control animals at week 3, and an overall trend of notably slower tumor growth than controls and other treated animals throughout the study. The ketogenic diet lowered blood glucose, elevated blood ketones, and decreased body weight. Prior to the study, initial blood glucose, ketone, and body weights were similar among the groups. Blood glucose levels were lower in the ketogenic diet treated mice than in the standard diet treated mice by day 7. By day 7, ketogenic diet fed mice lost approximately 10% of their initial body weight and maintained that weight for the duration of the study. Profound anti-cancer effects were observed in our metastatic mouse model after combining the ketogenic diet with HBOT. Combining these therapies nearly doubled survival time in mice with metastatic cancer, increasing mean survival time by 24 days compared to control animals. Figure 1. The ketogenic diet plus HBOT treated mice exhibited significantly decreased bioluminescence compared to controls at week 3, and a trend of decreased tumor growth rate throughout the study. Figure 2. By day 7, all animals on a ketogenic diet had significantly lower blood glucose levels than controls. As it has been shown that tumor growth is directly correlated to blood glucose levels, this decrease in blood glucose concentration likely contributed to the trend of decreased tumor bioluminescence and rate of tumor growth seen in ketogenic diet-fed animals. Nabling et al. Demonstrated that the ketogenic diet significantly decreased glucose uptake in pediatric brain tumor patients by FDG PET analysis. This clinical data suggests decreased glucose delivery to the tumor is a causal mechanism in ketogenic diet treatment. As ketones are metabolized exclusively within the mitochondria, cancer cells with damaged mitochondria are unable to adequately use them for energy. Many cancers do not express the SCOT enzyme which is required for ketone body metabolism. Furthermore, ketone bodies have anti-cancer effects themselves, possibly through inhibition of glycolytic enzymes. HBOT increases reactive oxygen species production within the cell, ROS, which can lead to membrane lipid peroxidation and cell death. Cancer cells with mitochondrial damage and chaotic perfusion naturally produce chronically elevated levels of ROS but are susceptible to oxidative damage-induced cell death with even modest increases in ROS. We propose a potential mechanism of ketogenic diet plus HBOT efficacy. The ketogenic diet weakens cancer cells by glucose restriction and the inherent anti-cancer effects of ketone bodies, while simultaneously conferring a protective advantage to the healthy tissue capable of ketone metabolism. This metabolic targeting sensitizes the cancer cells to HBOT-induced ROS production and oxidative damage, contributing to the efficacy of combining ketogenic diet with HBOT. Additionally, ketone metabolism by the healthy tissues likely confers protection against the potential negative consequences of HBOT, CNS oxygen toxicity. In our present study, HBOT alone did not improve the outcome of VM mice with metastatic cancer, but combining HBOT with a ketogenic diet elicited a dramatic therapeutic effect. It is important to look for synergistic interactions between therapies which may increase the efficacy of cancer treatment. Scheck and coworkers reported complete remission without recurrence in 9 of 11 mice with glioma by combining the ketogenic diet with radiation. Marsh et al. Reported synergy between the restricted ketogenic diet and the glycolysis inhibitor 2-deoxyglucose. Might adding HBOT to these combination therapies elicit even better results? Similarly, might the use of adjuvant therapies like ketogenic diet and HBOT enhance patient response to standard care? Our study strongly suggests that combining a ketogenic diet with hyperbaric oxygen therapy may be an effective non-toxic therapy for the treatment of metastatic cancer. The efficacy of combining these non-toxic treatments should be further studied to determine their potential for clinical use. Based on the reported evidence, it is highly likely that these therapies would not only contribute to cancer treatment on their own, but might also enhance the efficacy of current standard of care and improve the outcome of patients with metastatic disease.